Well, hello again there, everybody. It's been a while. Welcome into another Chamber Report. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. Busy night. It's like the night before Christmas for us. We've got the economic kickoff event tomorrow morning. That starts at 9 o'clock. You want to tune into that, you can still sign up at boonechamber.com. Dr. Harry Davis getting ready to give his annual economic forecast for the year ahead. You won't want to miss that. We've also got plenty of other great speakers and more information to share with you tomorrow as we work with our friends over at the Blowing Rock Chamber of Commerce to present this information to you. So again, that starts at 9 o'clock tomorrow morning. Sign up online at boonechamber.com. Tonight, we want to take a little bit of time and go through some of the information that came out of Raleigh today. Earlier, Governor Roy Cooper announcing that the current executive order is extending until the end of February. Really nothing changed in terms of orders that are currently in place, right? So we're not going to bore you with those details. We have lived this life for a long time. You know the drill at this point. Do urge you to head over to our website on our relaunch and recovery page and again, refresh yourself with some of the guidelines that are listed there. There's some additional information there too about the executive order regarding the sale of prepackaged mixed drinks, something that was given to the restaurants as somewhat of an economic boost. That's going to actually extend through the month of March as it is right now. And also some other language in there about how the state is adhering to the federal policy about eviction guidelines and basically an eviction moratorium at this point in time. So all of those executive orders have been updated. And again, no real change there. We want to spend the bulk of tonight on some important information that we've been waiting for a while. So over the last couple of days, a lot of information about vaccine process here in North Carolina. To be perfectly honest, the rollout has not been as expedient and as efficient as a lot of the folks involved in the process would like. So some pretty heavy lifting has been done here over the last several days to remedy some of those process issues, if you will. A lot of this has to do with the federal government's release of vaccine to the state, how that is deployed to the counties, and even that process is changing with the transfer of power at the very top and how a new administration is trying to unlock vaccine availability for states. So we're going to see some continued change to this process and how this will ultimately trickle down from the top of the federal government all the way down to the local level. So understand that we're getting there, right? There will be some changes coming. One of the things that was mentioned today in Governor Roy Cooper's press conference as he extended those executive orders, that got into the conversation about when it's going to be appropriate for the next move in group. Right now, of course, we're still dealing with that 65 and older population, frontline healthcare workers. Communities around the state are at different places with that because of volume of folks. That makes total sense, right? That there might be more frontline healthcare workers in one community versus another. There might be a larger population of 65 plus in one community versus another. So not everybody can progress at the same speed, but the idea there is to make sure that people are progressing through, for the most part, in some sort of concise and understandable way as they move from group to group. So the state is doing some work here over the next several days to see exactly where they are in group 2, how many vaccines have been administered to that 65 plus crowd. And ultimately, what does that mean for the timeline moving forward into the frontline essential workers? We have told you for weeks that we were waiting for some definitions from the state about who exactly fits in those categories, and not just hypothetical stuff. We wanted to see how that actually breaks down. Well, guess what, friends? On the eve of the economic kickoff event, we've got news that you can really use, and that is going to be some definitions in the groups on the vaccine front. So let's go to this web resource. I want to go back up here to the top here real quick, just to show you where you can access this information. So this is off the North Carolina Department of Health and Human Services website. This is their, you have a spot, take your shot website, right? So this links you to all of the state's COVID-19 vaccine information. There's a new tool here where you can find your vaccine group. That's very helpful, answering a few questions, and it will kind of point you into, based on those criteria, what group you might happen to be in. There's also information about vaccine locations. Real quick on this, there's been a lot of conversation about additional providers getting involved in the process, and that's another thing that both Governor Cooper and Secretary Cohen said is coming soon, but not too soon because there's not enough vaccine to go around. And this becomes a supply issue as much as anything. There are partners all over the state all over Watauga County. You can throw Boone Drug on that list. You can throw other private providers on that list, other healthcare agencies on the list of people who are eager to get that vaccine out and be a part of that process. However, right now, you're still looking at, for the most part, hospital systems and public health departments being the primary drivers of that activity in individual counties. We've talked a lot about how Boone Drug has set an example here in Watauga County, where they are actually working with the health department to help deploy their vaccines. Appalachian Regional Healthcare System will soon be having a vaccine clinic for their patients. So there are ways that people are trying to get out vaccine, where there is some news out there about the private sector not being allowed to be a part of this yet. That's not entirely true. The private sector is participating where they are currently allowed to help. Once vaccine supplies get a little bit more robust, then I think you will see an immediate push to get some of these providers who have applied to become vaccinators able to do so, provided that they meet criteria about data entry, about cold storage, all of the functional things that will make this a process that can be carried out the way it needs to be. Just because you want to give vaccine doesn't mean you necessarily get to. You have to be a provider that can handle that. Good news is here, when that gate drops in this county and throughout the high country, we've got some credible partners that can step in alongside our hospital systems, alongside our health departments, and make that a dream a reality. We're not there yet. So keep in mind that the vast amount of the information you're going to see about vaccines are going to come through Appalachian Regional Healthcare System, and for us here in Watauga County, of course, App Healthcare. So let's talk about where we are in the groups right now. Scroll down to the page a little bit here, and you find that the active groups are still groups 1 and 2. That's healthcare workers, long-term care staff and residents, older adults in there as well. Remember the element about this long-term care staff. That's where CVS and Walgreens have been administering that program to vaccinate folks in those facilities as part of a federal program. So they take some of the county allotment for vaccines and they'll go into those facilities that have requested vaccination support. And that's where Walgreens and CVS are kind of looped into this at this point in time. You can't go to one of those places and get a vaccine if you're just walking in off the street. Those particular businesses are administering first doses, now second doses to folks specifically in those long-term care facilities and for staff and residents. So that program seems to be, in some areas of the state, winding down a little bit. The first doses have been applied to a lot of the folks that require those. Now, there are some questions logistically about how things will work when people get admitted into those facilities. Will they automatically receive a vaccine, or will there have to be kind of a double back at some point in time to catch people that might have come in after the initial wave of vaccines occurred? But we'll get to all of that at the appropriate time. Let's get to the big news here right now. This is exciting. Frontline essential workers. And I say it's exciting because we finally know what they're talking about. So let's go down here to group 3. You can expand on these groups. Not all of them have great information on them yet, but group 3 is one. Frontline essential workers. It says here the CDC defines frontline essential workers as workers who are in sectors essential to the functioning of society and who are at substantially higher risk for exposure to COVID-19. Don't we all wish to be essential workers that help determine the functioning of society? I think we all are in our own ways, but let's see at least how it works in this definition. So we're going to click on this link here and get into a deeper dive on group 3. Now, this is what is helpful. So let's go in here. The goal is to protect those at high risk of exposure. Frontline essential workers in this definition are people who must be in person at their place of work. Huge piece here. All right. Remote workers, this isn't necessarily your best entryway right now. We're talking about people that physically have to go to a place to do a thing, and people who are in one of the 8 essential sectors listed below. So what are those essential sectors? We've got critical manufacturing and some examples that are finally in here that help us understand who all is wrapped up into this. So you're looking at critical manufacturing, people working on medical supplies, PPE equipment, manufacturing products needed for food and agriculture supply chains. Obviously, Watauga County, not a major manufacturing center like some areas of our state, but there are some businesses that fall into these categories that will be able to see their prioritization finally manifest itself here in group 3. Education. This is a major one for our county, and let's look and see how this is defined. Education includes childcare staff, K-12 teachers and support staff, college and university instructors and support staff. As you can imagine, with all of the child care facilities we have in this county, Watauga County Schools employing 700 folks, Appalachian State University employing thousands of folks, Caldwell Community College and Technical Institute employing a large staff. This particular box right here eats up a pretty good bit of our workforce. Not a major piece, but a rather large chunk. Probably the largest that we have seen thus far, just in terms of volume. So these folks will be eligible under Group 3 here, frontline essential workers, to be able to reach that priority for vaccine. Now, there's been some conversation about prioritizing within the group, and there's some discretion that local public health departments have and hospital systems have to prioritize based on some of the criteria that we've talked about a lot: age, the type of job, those types of things. The state is giving them some wiggle room there. Nothing is absolute, though. What all this says is basically these are the businesses that are allowed, but there are some counties that are working to make sure that kind of the highest risk within the highest risk, those people are prioritized. And you can make a case that a lot of those folks working in education need to be toward the top of the list because of the need, and all the way from the president on down through the governor and local officials wanting to open schools up more robustly. We'll talk about that more in a moment. But this is a way to get a lot of those folks that have high touch points in the education side to get their vaccine. Let's look at some other things real quick. Essential goods, for example, workers in stores that sell groceries and medicine. Food and agriculture was another one that we were really curious about how far they would go. So you're looking at meat packing workers like the Tyson plant down in Wilkes County, Goodnight Brothers here in Watauga County for sure. Food processing workers, same kind of thing. Farm workers, agriculture sector, that will become more important as we get into the spring. Migrant farm and fishery workers, food distribution and supply chain workers, and here's the big one, restaurant workers. Yes, this was one that we were kind of wondering, where did food and agriculture stop? Restaurant workers, and no definition about a difference between a maitre d' and a dish cook or a dishwasher and a frontline cook. Restaurant workers means if you work in a restaurant, you qualify for this Group 3 status here. Other services that are in there, we see some government and community services like the post office, court workers. Where there's been a lot of change here in North Carolina about just what the courts are doing now. So they're a little bit more active. So they're in there. Clergy, folks that work with homeless shelters and facilities like that. Healthcare and public health. So you're looking at some public health workers and social workers that haven't already been vaccinated. Remember, Group 1 is about people that are facing patients with COVID. This kind of steps out the rest of the folks that might not have that frontline spot, but certainly get this. Public safety is another one, goes back and catches up on a lot of those folks that didn't get caught in the front line. Firefighters and EMS, law enforcement, on down to corrections, security officers, public agency workers responding to abuse and neglect, things like DSS, things along those lines. And then finally, transportation, public transit workers or Apple Cart bus drivers and staff, DMV workers, transportation maintenance and repair technicians, the NCDOT folks that are clearing the snow tomorrow morning. They're going to be in this mix, as well as workers supporting highway infrastructure. And again, that gets back into DOT and some contractors that are involved in that. So that's Group 3. Now, what all does this mean? What this means right now is that we have some definitions to work with. What I would encourage employers to do is, if you haven't already, if you're in one of these groups right here, it's time to start having the conversation if you haven't already. Are you indeed going to consider being vaccinated? And if so, it may at some point in time be helpful for you to have some of that information readily available. I'm not talking about creating big spreadsheets and having huge lists right now. What I am talking about is listening to what App Healthcare is asking you for. Listen to what Appalachian Regional Healthcare System will be asking you for. If there is anything about trying to get an employee list together or trying to take an informal survey amongst your staff to give those two entities an idea about how many folks we're talking about in Group 3. Because again, this could be a huge group. We've got a video that's involved in this email tonight from Dr. Scott Elliott, Watauga County School Superintendent, talking about Watauga County Schools operation, kind of an update there. But in there, he talks about 700 employees with Watauga County Schools. 640 of those employees have already indicated to the school system that they would like a vaccine once it becomes available for them. So you might want to do a little bit of that quick math. Just go around the office. Hey, if you're eligible for this, what would you like it? So if that question is asked of you about how many people might want vaccine in your place of business, you can answer that quickly and accurately and help give our community health staff an idea to understand just what kind of numbers they're talking about. So this is group 3. Okay, let's back up here a little bit. One nice thing about the state website, look at all these tabs that are open up here. That's all just clicking around on their site, right? So let's go to group 4. And group 4 is a ways down the road. Don't exactly stand up to board the plane just yet on this, but group 4 is adults at high risk for exposure and also essential workers not yet vaccinated. And we want to just take a brief moment and go through that category of folks. So there are some conditions that are listed here, some of those high-risk medical conditions, everything from asthma, types of cancer, diabetes, types 1 and 2, and on down the list. You can see that's a rather long list. Folks that are living in a closed group living setting, homeless shelters, correctional facilities, those types of vaccinations come in group 4. Essential workers not yet vaccinated. This pretty much takes care of the vast majority of everybody else, right? A couple of big categories here, and I'll list them all off briefly, but a couple of big categories. You know, you look at chemical, those that are working in pharmaceuticals, petrochemical plants, commercial facilities, including retail workers, hotel workers. Retail workers, I mean, that runs the gamut, right, of basically any kind of commercial facility. So if you're not in one of those groups in group 3, this is where you go right here. Communication and information technology, everything from the media to data center operators, a defense industrial base, that doesn't really apply to here as much. Energy, those working for our electric cooperatives, our gas providers, those are awfully essential people at a time of year like this. Financial services, hazardous materials, hygiene products and services. That includes laundromats and sanitation, things to keep the area clean. Public works and infrastructure, residential facilities, housing and real estate, anybody involved in that area, and then water and wastewater. So again, you can look these over. I encourage you. I'm going to scroll all the way back to the top here. I'm going to click back on this DHHS website. They've got some great dashboards up. They've actually improved some of their reporting around vaccines at this point in time to share more county-specific data about what vaccines are coming, how many first doses are given, second doses given, things like that. So go to that DHHS website. It's linked off of our Relaunch and Recovery page. You're going to find a lot of great information there. We also have some PDFs in this email that will explain all of those things that I just went over with you in a little bit greater detail. I think the important thing to take away are these two things. One, it's time to start paying attention a little bit again. Those of you that have maybe checked out of the vaccine process thinking, I'm so far down the line, I'm just not even going to worry about it right now. Again, some changes, some subtle, some not so subtle changes in distribution method, manufacturing, those types of things could very well speed up a process that has not exactly been swift. I can tell you this, at the supply chain issues that we're having in terms of getting vaccine doses, the county folks, the folks that are here in Watauga County have about the least control in this process of anybody. Some of those paths to communication are improving those. So hopefully our local groups are going to be able to predict better how many vaccines they're getting in a certain week, how they can administer those. Can we see more mass vaccination clinics? Can we see more cooperation between multiple agencies? Can we get new providers listed into this? That's all stuff that we hope to hear more about in the coming weeks. So if you're not paying attention, start to listen again. You want to make sure that when your group is there, you've got the opportunity to get vaccinated if you want to do so. So also make sure, if you haven't already, go to the App Healthcare website, fill out that vaccination interest form, make sure that they've got your data there. Or remember, in Watauga County, if you're an Appalachian Regional Healthcare Systems patient through one of their practices, chances are you've been contacted if your group is eligible, or you will be contacted when your group is eligible. If you're a patient, they've got your date of birth, they do the math, they let you know when those opportunities are available. So pay attention. Make sure that your contact information with your medical providers are accurate. You don't want a mistransposed cell phone number being the difference between you being able to get the vaccine and not, or being notified about that kind of thing. The other thing I'll say is this: remember that as we get more into the vaccines, we did get some encouraging news today from the state about some of the statewide healthcare metrics maybe leveling off a little bit, and in some cases improving. We hope to continue to see more of that, right? And the governor mentioned too that while he extended his order for a month, if we see continued healthcare metrics like we've seen at other times, they'll jump the gun a little bit early and can maybe make a change in a more positive direction sooner than a month from now if the numbers indicate that. So remember what your role in all of this is. There's still a secretary's order from Dr. Cohen mentioning that if you don't need to be out, don't be out. And if you do, wear a mask. There's all those criteria. We have an opportunity right now to speed this process up somewhat ourselves, and that's by remaining vigilant. Wear the mask, practice the 3 W's, do what you can for your family, do what you can about limiting the crossing over of large groups, whether that's family to family, office staff. This is not the time to get everybody together and do the catch up. Let's go out and sit around the office and share coffee with masks off and chit chat for a little bit. That is where some of the community spread that we're seeing in Watauga County, quite honestly, is coming from. Those close settings, people coming from separate households, getting together. We can help speed this up if we play by the guidelines that have been established by the CDC, by the state of North Carolina, the federal government, the local governments, and try to get this thing over with as quickly as possible. There is some light at the end of the tunnel. I don't want to tell you we've turned the corner just yet, but I think it's safe to say that we've at least got our blinker on, which if you don't turn your blinker on, you should think about that. It's an awfully nice thing to do. All right, so here's the deal. We've got all these things linked on our Relaunch and Recovery page. Check out this email for more information. Read through that. Check out the interview with Dr. Elliott as well. He's got some information on the survey, those of you Watauga County Schools parents, that you got a link to today in your email, and why they're asking about Watauga Virtual Academy moving beyond this year. Really interesting rationale behind that. And it's not all COVID related. As a matter of fact, very little of it is, but maybe one of those opportunities to see something come from a unique circumstance that could become a longer answer to some important questions here in terms of delivering education in our county. So check that out. Make sure you're registered for our event tomorrow. A lot of great information coming your way. Folks, thanks for all you're doing to keep Boone healthy out there. We know that it's been a grind. We know that we're ready for some differences in our daily routines, and we'll get there if we all continue to work together. So on behalf of our entire staff, thanks for indulging us. Continue to read the rest of your email. I'm sure you've got something in there about your car's extended warranty too. So make sure you get that taken care of, and we'll see you tomorrow morning. Take care, everybody.